This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're at Aurora Health Center in Oshkosh, and today we're heading up to the pediatric department. We're going to be talking with Dr. Valerie Zapolsky about the flu. Well, thank you for joining us today. I think everyone knows what it feels like to have the flu, but what exactly is the flu?
The flu is a respiratory virus. It is not your 24-hour vomiting diarrhea flu that people talk about. It is a severe respiratory virus. You get high fever, cough, runny nose, headache, and those body aches. That's really what people recognize as the flu, when your whole body just aches and you don't want to move. And you're sick usually for a week. It causes a lot of secondary pneumonias, people who get pneumonia after they've gotten the flu. Rather than getting better, you're getting worse. And it actually kills, in the United States, 20,000 to 35,000 people every year. So it's a severe disease.
Wow. Well, it seems like last year about this time we were talking about H1N1. That was a big buzz last year. Will we have to worry about H1N1 again this year and the seasonal flu?
Yes and no. H1N1 is still around. Right now it's not causing any big amount of problem, but it's really just another flu, and the flu changes every year. So every year you have to get your flu shot, and that's not because your immunity wears off, but the flu changes. And so they make a new flu shot every single year to cover for the new flu that's circulating. The problem that happened last year is they already started cooking the batch January, February. The H1N1 hit in April. It was too late to add it to the batch. They had to make a second batch. And so it was very difficult for people, very difficult for us, because we had to give all these twice as many flu shots. So this year, they know it exists. It'll all be in the usual one seasonal flu shot.
And you certainly don't want to get the flu. How do we prevent it?
The best way to prevent it is get your flu shot, okay? Flu vaccine. They do make two different kinds of flu vaccines now. You can get the traditional shot, and they make it specific ones for different ages, or you can get the flu mist, which is the nasal spray. And so we're hoping that a lot of people, healthy people who otherwise avoid the flu because of the shot thing, they'll go get their flu mist, which is a very little squirt up your nose. You don't even smell anything. You don't feel anything. It's a tiny amount. I did it once. It was like, that's it. It was so easy.
Not like the old days.
Not like the old days. So yes, you've got to be, a healthy person to get the flu mist, but we're hoping that it makes a lot more people go get their flu vaccine, because that's the main way to prevent it. Other things you do is, wash your hands, don't share sodas with people, things so you're not catching it from people. And when you're sick, stay home so you don't spread it to people. But the main way is vaccination. There aren't very good medicines once you're already sick.
Do you think it's necessary for everyone to get vaccinated?
We really would like everybody to get vaccinated. They didn't used to make enough every year. They're slowly making more and more every year. So we do recommend everybody who's high risk, children less than 2, adults over 65, pregnant ladies, people with underlying medical diseases should definitely go every year. But really they're recommending everybody over 6 months old get their flu vaccine, because if we get to the point where people are 80% of the population is getting their flu vaccine, like 80% of the population, closer to 90, get their diphtheria, tetanus vaccines. So we don't see those diseases anymore. If we could get the flu vaccination that high, then we wouldn't have 20,000 people dying of it every year.
Well, some people are going to get the flu this season.
Yes.
There's no getting around that.
Right.
If you do get the flu, how do you treat it?
Best thing to do is do all the stuff your mother told you to do. You stay home, you stay in bed, you treat your fever, you drink plenty of fluids. There are antiviral medicines. They're not very good. They make you maybe a little less sick for 1 day. So you're a little less sick for 6 days rather than 7 days. They're not very good. It's not like we have penicillin for strep. There's just nothing like that for viruses. So really we use those medicines on people who are severely ill in the hospital or have major medical problems, because we're trying to make them maybe not die. So those are the people that we use those on, to just make them not quite so sick. But the everyday person, just stay home and take care of yourselves, and don't go back to work and cough on everybody until you're not having a fever.
Well, I've already gone through a week this year where I felt crummy. And how do you tell if it's the cold or you're dealing with the flu?
The flu, like I said, it's a severe virus. A cold, you have a runny nose, you're a little itchy, but you don't have that severe high fever, body aches, uncontrolled cough where you're just like, you're hacking over everybody in the office and everybody in the office is going, stay away from me. You probably shouldn't be there. You probably should go home.
And that goes for children staying over from school and people going to work as well. Number one rule on that?
The main thing, if you've got a fever, we call a fever a temperature over 100.5, you shouldn't be at work or at school. You're just infecting other people and spreading things. And if you've also, on top of it, got uncontrolled cough, or you're obviously got vomiting and diarrhea, you don't want to go to work or school. Once you're feeling better, your fever's gone for 24 hours without medicine. Taking, fever reducers every 4 hours doesn't mean you don't have a fever. You got to be no medicine, no fever, and then no more uncontrolled cough, because that's how it really spreads, coughing and everything.
All right, great advice once again. We appreciate you taking some time to join us today.
Thank you.
If you'd like to know more about the flu or to schedule an appointment with Dr. Zapolsky, you can call Aurora Health Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.